So the mini gastric bypass is a pretty poor name. It really is still a big operation. There's not that much that's mini about it, but it's a much less complicated and risky operation than the Roux-Y gastric bypass, which was the original. So what the word mini is really meaning is a safer bypass. The way we perform this procedure is to first construct a long, thin tube of stomach without actually removing any stomach. Then we measure out a length of your intestine. Our average length that I use is 180 centimeters. We bring that up and we join that on to the end of that long, thin tube of stomach. This is called a lupanastomosis. What this means is that food will come down into that long, thin pouch of stomach before transferring itself into the small intestine and traveling down. And it delivers the food into the lower part of the small intestine undigested. It turns out that the lower small intestine doesn't really have to do all that much work typically. Most of the time, the lower intestine is just checking that the upstream intestine has done all the hard work of digestion and picking up anything that's left over. But when we make the small intestine lower down do the work of digestion, it pushes back by the production of some very powerful hormones. And these hormones travel around the body to be not only appetite suppressive, but to improve the function of glucagon and insulin resistance, which are all messed up in people who've got diabetes. So if somebody's got diabetes, a bypass operation can be a very powerful way to get their diabetes corrected, as well as to help them lose weight. Gastric bypass operations are often best for people who are either particularly overweight, severely overweight, or those who have diabetes. Well, I hope you found that helpful. You can access lots of information on my website, but we'd love to hear from you. You can get in touch on my email or during business hours on the phone number.